the meeting, everybody. We could go ahead and get started. Good afternoon, everybody. Welcome to the June 18th Continuum of Care meeting. Can you guys believe it is June the 18th?
Oh.
And I think, you know, we are finally now going to start to feel the heat of summer.
Have a talk with
So let's go ahead and dive in. For those of you, can you mute your mics if you're not speaking?
Maybe the other speaker. Try it.
Thank you. Appreciate it. Okay, everybody. At this time, you will see that Zuli placed in the chat the link for roll call. So those of you that are voting members, please click the link so that we can make sure that you are here. I always want to emphasize we need to make sure that we have a quorum. We do have consent item to take action on, so don't forget to do that. If you're not a voting member, just remember you can become a member of the Continuum of Care very easy by going to csc@rivco.org, and there's an application and a letter template. And then to become a voting member, all you need to do after you've gone through that process is attend 3 consecutive meetings. And it's so important that we all have a voice on very important policy issues facing our region. So for those of you that are not at that point in your participation with the Continuum of Care, I would highly encourage you to do it, because we want a very broad, diverse, vibrant consortium of all of us working together to make a difference in the quality of life for the people in the region. Do we agree? Okay, so let's go ahead and go on to the next slide. Public comments. At this time, members of the public may address the Continuum of Care for items that are not on the agenda. Each speaker has up to 3 minutes to speak. Zuli, did we receive any written comments for the public record?
No.
Okay. Do we have any members that would like to address the Continuum of Care? If so, please indicate by raising your hand electronically. Do we have any speakers? You guys are quiet today. Okay, let's go ahead and move on to the next agenda item. We're going to move to agenda item 2025, Board of Governance nominee introductions. And I believe that we have Roshana to
Madam
talk
Chair.
to us.
Yeah, Madam Chair, this is Tanya Torno. I'm actually going to be doing this piece. Roshana was so gracious with a last-minute scheduling change and is giving me the pleasure of speaking on the Board of Governance. So I'll just go ahead and jump in and share that we have 4 vacancies on our board. And as all of you know, the Board of Governance plays a critical role in supporting the strategic efforts of our Continuum of Care and making sure that all of the different projects that are funded using multiple federal and state sources all align with our objectives as outlined in our homeless action plan. And I should note that we have 14 seats, and each board member commits to a term for a 2-year period. And the 4 seats that we have available will begin or go into effect as of July 1st of this new fiscal year and through June 30th of 2027. And we invited the different nominees that all of you submitted a nomination for to the Continuum of Care, so they could join us and speak for anywhere between 1 and 2 minutes to talk about why they would like to join the board. And so I'm thankful. I know I already see some their faces here, and I know that they're eager to share with you on their why. we'll start off by just naming the different seats that we have available, which include one public sector seat, the second, a private sector seat, the third, a nonprofit sector seat, and then the fourth seat is for someone who has lived experience and has been formerly homeless. So excited to share that Mayor Jim Steiner with the city of Corona is has been nominated for the public sector seat. And if he is here, Mayor, if you are here, we'll go ahead and give you 2 minutes to make an introduction. Thank you.
Yes, thank you. Can you all hear me okay?
Yes, we can.
Okay, great. So good afternoon, everyone. My name is Jim Steiner. I'm currently the mayor of Corona. I was a firefighter for 34 years, the last 31 for the city of Corona. I retired in 2017 and decided to run for city council. One of my primary platforms was to address homelessness in Corona. For decades, I responded to medical emergencies involving our homeless neighbors, but I really only had the 911 response aspect of understanding, the homeless crisis and, and how to deal with it. So I had a lot of learning to do. I began touring homeless shelters, transitional and permanent supportive housing projects, motel conversions, and inclusionary housing projects from Coachella Valley to Orange County. I attended many lectures and seminars. I met with various individuals who had expertise in the field, all in an effort really just to learn more. I was elected in November of 2018, and right away I began to champion the need to develop a homeless plan. And I was immediately assigned to chair the newly established Corona Homeless Ad Hoc Committee. And I was successful in getting full council support to develop and invest in a plan. This is probably a key here. I was also successful in convincing Karen Roper that she needed to come out of retirement and assist the city of Corona in developing a plan, which again was the key to our success. Without her expertise and leadership, we would not have been able to establish the A to Z strategic plan that addresses prevention, outreach, shelter, housing, and services. Our city of Corona invests a significant amount of money of our Measure X city sales tax funds to our homeless plan every year. And these funds help us, leverage federal, state, and county funds and help provide a flexible and sustainable funding source for operations of our system. And to answer your specific question, I don't know if I have any special skills that would, automatically think I should be elected to this position. I do think I have a unique background with firefighter for so many decades and understanding one half and then putting in the work to understand the other half. So I am a worker and I am a learner, and I hope you would consider me for this position. So thank you.
Thank you so much, Mayor. We appreciate you joining us today and sharing a little bit about your why.
Thank you.
We'll jump over next to our private sector seat nominee, Dr. Lee Johnson. I should note that Dr. Lee currently sits on the Board of Governance and has for the last 2 years. So we're excited to see that he is interested in returning.
Certainly interested in returning. Welcome and good to see everybody. Let me say first, thank you to the entire COC, this amazing leader, Karen Roper. I just love her. So anytime I get to share space with her, it's always great. Tanya, you already know what it is. It's always love. And to everybody here who's doing the amazing work every single day, oftentimes unseen, unheard in the background, I just want to extend a big thank you to all of you guys for the great work that you do. I'm Reverend Dr. Charles Lee Johnson. I've been fortunate to serve for 2 years on the Board of Governance, looking to serve for another 2 years to provide continuity. So my background is that I was someone who was formerly homeless. My mom and I, when I was younger, my father was addicted to crack cocaine. My mom, in a fight in order to create stability for us, we just experienced housing insecurity. But we're able to work ourselves all the way through. I'm a social worker by training, former dean at California Baptist University, current pastor of the Life Church. research, and today the CEO of a company called the Children's Collective that does about $20 million of business for poverty alleviation. My commitment and what I'm looking to continue over the next 2 years is really advocating for our smaller nonprofits, agencies that sometimes don't know how to get funding, not sure how to align with some of the larger goals that our funding requires, is to be that voice for you on the board of governance. And so I've done that over the last 2 years with the suggestions that I've made. As a pastor, I get to see firsthand of being alongside folks who are struggling in order to make it and getting them into resources. And so my goal is to make sure that we strengthen the nonprofits, the faith-based organizations, the CBOs who can do incredible work and have great resources in order to be the voice and to be the service for those who are in need in our community. So I'm excited. I hope that I get your vote. I would love to serve. Either way, I'm going to be serving alongside you. So this would just be another way in which I'd be able to serve alongside you. But very grateful for the nomination and looking forward to being able to serve, hopefully, for another 2 years. Thanks, everybody.
Thank you, Dr. Lee. Moving on to our nonprofit sector nominees. As you can see, we have received names for 4 different candidates who are here on screen, and we're also eager to hear from them on their why. We'll go ahead and start with Dr. Adrienne Mason.
Hello, everybody, and good afternoon. And thank you, Tanya, for that introduction. I am Dr. Adrienne Mason. I am the CEO and Executive Director over here at His Daughter's House. We are based in Riverside, but we serve all of Riverside County. So we're in the city of Riverside, but we serve all of Riverside County. We provide homeless prevention, rental assistance, linkages to healthcare, and supportive services. We have grown exponentially over the last few years. We started out as a DV wrap rehousing service provider, and we've been bestowed several different lines of business, including healthcare line of business, homeless prevention, and supportive services. So we are a 360 wraparound organization and hope to continue to grow and expand in that direction. We ventured out into LA County, and we also serve San Bernardino with other funding that we receive. So very excited to expand our reach and continue to serve those in need in our county and beyond. We've been in Riverside County for about 6 years now. So we have been a part of the COC since our inception here. We saw the need. We came from LA County. We saw the need over here in Riverside, and we just started moving and shaking. We were like, you know what? We got to get connected to homeless services in Riverside County, and it's been a great experience. Tanya and Marcus Cannon are 2 of the first individuals that we met and made connections with, and it just snowballed from there. It's been a great ride. Happy to work alongside everybody in the COC, just because we're doing great work here and we love what we do. So, and it shows. It shows in our clients, it shows in our participants, and it shows in our staff. In an expanded capacity, and just and help with the nonprofits, help in this sector, help smaller nonprofits, those who are starting out like we did. We documented a lot of our process, so we'd love to be able to partner and be able to provide those services and that support like we had. And just being able to create and add to policy making, and just being able to improve our homeless landscape and our outlook here in Riverside County. So I hope you vote for me. We have a heart for all those in need. We're expanding our reach to our youth. We started that at the end of last year just because we see a great need in the TAY population, and also seniors and veterans. So we are all encompassing. So we got you covered here at His Daughter's House, and we hope to be able to transcend that help and that expertise over to the Board of Governance.
Excellent. Thank you, Dr. Mason. Our second candidate is Rochelle Brown with House of Love. She may not be on yet, but I'll circle back with her at the end just in case.
I'm sorry, my mic wasn't on.
I thought that might be a case. I was going to circle back with you, but since we can hear you, the floor is all yours.
Well, hello, everyone. I am Rochelle Brown, and I get to be the CEO and founder of RB House of Love, which is a nonprofit that serves our non-minor dependents with transitional housing, ages 18 to 21. And RB House of Love became into existence because I've been in the foster care world for 17 years. I had the honor of starting off as a social worker, moved to the supervisor, and then the administrator of a wonderful nonprofit where we serve the foster youth. So in my tenure being in the foster care world, God put a nudge in my heart to open up transitional housing. And this was in 2008. And all I remember was saying, okay, Lord. But as I grew in the agency, like I said, the social worker moved to the supervisor. And in 2008, all the children had to exit foster care until we had the AB 12, which was voted on in 2010 and then became law in 2012. So my heart started to flourish to help those non-minor dependents with transitional housing. And in the interim of that, I just really stepped out on faith. As of last year, my nonprofit been in existence for 7 years, but this is the year, was starting at the end of 24 and 25, that I just said, you know what, God, I'm going to be obedient to what your word is, and let's get started. So right now I am in the licensure stage. I just received my support letter from Riverside County. They're in support of my non-minor dependent program. So I'm headed off to the licensing world. So yes, CCL, here I come. But I wanted to become to join the Continuum Care board because and also I have a contract with Department of Healthcare Services where I do community supports. And in that interim, I get to work with the homeless population. So, being on the board, this is something that I think that I'll be helping to help the solve the homeless housing epidemic, and I'll be able to input and represent the agency and also get experience from how the board of governance work when it comes to making those decisions with the housing program. So just looking at an opportunity to serve and expand my educational and experience with the with the homeless population, and being with Riverside County for so long, just expanding, and broadening my education and learning more about how I can serve the community a little bit broader and better. And thank you for your vote, for those that vote for me. Thank you.
Thank you, Rochelle. Next, we'll hear from Claire Jefferson Glipa with Family Promise.
Hello, everyone. Good afternoon. It is an honor to be with you today. I absolutely am proud to be the Executive Director of Family Promise of Riverside. We serve unhoused children and their families with dignity, love, and our goal is to get families home in 90 days. I have been really privileged to be able to partner with the COC in the 3 years, almost 4, that I've been on this journey to help families find home. And it would be an honor to be able to serve in a governance role. My why at this moment is because I think our society at large is at kind of a nexus point to decide our values in whether or not we believe that we have a responsibility to every single neighbor. I think we all have the same answer to that question. Of course, we are responsible for our neighbors, and we want to ensure that everyone within Riverside County has the ability to live a thriving life. And some folks need a little more support than that. And so it would be an absolute honor to be able to continue to lead the charge that our COC has continued to do and will continue to do during these kind of challenging times around funding, around guidance and ordinance to continue our path to ensure that every person within our jurisdiction has the privilege of having a home. And so I'm super excited for this opportunity and honored to be among these other amazing women. I'm just going to say the melanin is popping on the screen. So I'm like, yes, we win no matter who we choose, people. But I am very, very grateful to be a part of the COC and part of Riverside County, a jurisdiction really leading the charge within not only our state, but within our nation to ensure that every member has home, seeing home as a human right. And so it would just be an honor to be able to lead this work in this way. But as I said, I think, listening to the other women on the screen, that we really are in great hands no matter who we choose. And it's always a phenomenal day to be among like-minded folks who are willing to commit not only their heart, but their life's work and their education and their passion to serve the most vulnerable in our community.
Thank you, Claire. Next, we'll hear from Nikisha High with High Expectation Development Corporation.
Hello, everyone. My name is Nikisha High. Can you hear me?
Yes. Yes, we can.
My name is Nikisha High with High Expectation Development Corporation, and we are a nonprofit organization that has been established since 2017. My main objective is to be on the board of governance to help the homeless population get input and be an insight to this great work that we do for the homeless. I was currently in 2007, I was homeless, and it was me and my children. So I come from a background of being homeless, and not only that, we have a street outreach team. We help the homeless individuals, but not only help them, but we bring them stability, and I would love to be a part of this community. Thank you.
Thank you, Nikisha. And next, we'll move over to our candidates for the formerly homeless representative seat. And once again, we have 4 candidates. We'll first hear from, actually it's Rainbow Marlowe. I know Rainbow, I'm looking at the picture. It says Danielle Johnson. So that is a typo. We'll fix that as we speak. But Rainbow Marler with Operation Safe House is here. And Rainbow, we'd love to hear from you.
Hi. Yeah, I got that was a little weird, but that's okay. I know my own face. Good afternoon. It's great to be here today, not just as an advocate, but as someone who once needed the very support we work to provide. My journey from experiencing homelessness and foster care to helping lead countywide efforts such as the point in time counts for youth is not just a personal story, it's a testament to what's possible, especially when we serve our young people with compassion and intention. So every policy we shape, every shelter we open, and every youth voice we center brings us one step closer to community where no young person has to navigate crisis alone. So I'm very grateful to be here and to help young people navigate crisis. I'm deeply grateful to do this work, and I've especially in a place that I've called home. Riverside County is where I grew up, so it's great. And yeah, I thank you for the nomination. That's pretty much it.
Thank you, Rainbow. Next, we'll hear from. You can put up the screen, I believe. Let's jump over to Danielle Johnson. Oh, my apologies. We'll move over to Elaine Sanders. Elaine, we'd love to hear from you. She may be having some technical difficulties, so we'll circle back with her right before we wrap up, just to be safe. We will next hear from Sherry with Transgender Health and Wellness Center.
Good afternoon, Sherry Finke. I'm very honored that someone thought enough of me and my experience to nominate for me. I am formerly homeless. My background is I worked for over 2 decades in the private sector on DoD prime contracts, and during a downturn found myself with hundreds of others out of a job after a plant closure, after another corporation bought our corporation. After 3 years of living off my savings, I was at my wit's end, at the end of my rope, and I was real blessed to end up in an one knows here, Coachella Valley Rescue Mission. Thanks to them and all the good work that you all do here as part of the continuum of care, I was able to heal, and out of it, I got the job I always wanted was to work at a nonprofit. I was able to use my contracts, management skills, my knowledge of government regulations, and get into grants writing for them and other development. And while I was there, I got us started on ESG rapid rehousing, also administered EFSP contracts, CDBG contracts. Got to work with all of you and just very blessed to do so. After 4 years there, I did move on to a small mission on Oahu where I joined the continuum of care there and also administered government and private grants there. I'm happy to be back in the desert I love. I'm happy to be working again, helping the homeless and representing people from all walks of life, regardless their lived experience. I'm tearing up because the work that is done here is so important. And not only do I have a heart for the homeless because I was homeless, but I've had the special honor of meeting so many of the people that this continuum serves. And I just want to just thank you all. So y'all have a good afternoon, and thank you for allowing me to speak.
Thank you, Sherry. Next, we'll hear from Aicha Pacheco with Community United in Tradition and Education.
Good afternoon, everyone. Thank you so much for having me today. I am running for the formerly homeless seat because I've lived through it. I still carry that with me in everything that I do. I'm currently a full spectrum birth worker, a community organizer, and a workforce advocate. I show up for people during some of their most vulnerable moments, whether that's giving birth, finding stable work, or navigating systems that were never really built for us. So wearing all these hats has taught me that care and policy have to go hand in hand. You can't design real solutions without listening to the folks most impacted, right? So that includes people like me who've experienced homelessness and come out the other side, still fighting for those other folks. I'm here not just to represent my people, but also my own story. I would like to hold space for those people, for those voices that don't always get heard. This seat matters, and I'm ready to bring lived experience, care work, and community rooted wisdom to the table.
Thank you, Aicha. We'll go back to Elaine Sanders, just in case she was having microphone issues, technical issues. Okay. And that wraps up all of the presentations we had from our nominees for our Board of Governance. In the or attached to the link with all the documents for today's meeting, you will also see the biographies that we included for each candidate. And then we are going to be dropping in a link to the chat box where all of you who all of our COC members who have voting rights can vote or put in your votes for each of the respective seats. We'll also make sure to send out an email announcement so that if there are members who were not able to make today's meeting, we can ensure that their voice is heard. But I want to close off by just thanking all of our different nominees for their interest in representing the over 200 voices that we have across our entire county and who are part of our Continuum of Care membership. As I mentioned earlier, the board plays a critical role in helping us implement the goals and objectives that are outlined in our homeless action plan and essentially helping projects come to life, which many of our board members spoke to, that day to day help so many people escape the crisis of homelessness. So thank you again, and thank you to our COC members. This is your call to action. We need you to vote. The voting period will end on the 25th, and shortly after we will make an announcement of all the different winners. Thank you.
Good job, Tanya. Thank you. Did we have a question from Monica? Your hand is up. Okay, we'll go ahead and move on to the next agenda item. Leadership Spotlight. You all know I love to do this. There's so many inspiring leaders out there. And the leader we have today is among them. And I'm just honored to be able to introduce her. I think the absolute world of her. Cindy Huey. She leads our Riverside County Housing Authority. And you know, we have what, 7,303 square mile county. A lot of responsibility, a lot of hard work. I want to tell you a little bit about Cindy. She's currently serving as the Deputy Director for the Housing Authority in the County of Riverside, a division within the Department of Housing and Workforce Solutions. Ms. Huey has held this position since 2022 and has been with the Housing Authority since 1998. Over the last 26 years, she's served in various capacities in the Housing Authority, such as a housing specialist determining eligibility for new participants off the wait list, as well as continued eligibility for program participants, the Family Self-Sufficiency Coordinator, assisting participants in their journey toward economic self-sufficiency. I love that program, by the way, Cindy. As well as the Program Manager for the Housing Authority's Housing Choice Voucher, as we all know, is Section 8. The former Affordable Public Housing Program, Housing Options for People with AIDS program, Family Self-Sufficiency, Resident Opportunities for Family Self-Sufficiency, Shelter Plus Care, remember Shelter Plus Care, and the Integrity Unit. I could go on. She has a long career in all of these very complex housing programs, and I think you all know that the Housing Authority serves as a huge safety net for so many people. Cindy, it's always such a joy to be able to work with you in many different capacities. I want to thank you for your willingness to present with us today. The floor is yours.
Well, thank you, Karen. It's always a pleasure. And thank you for welcoming me to the community share meeting today. So as Karen shared, I am currently serving as the Deputy Director. I've had the pleasure and opportunity to do almost everything here. So with our Housing Choice Voucher program, we currently assist about 91 households monthly with a portion of their monthly rent. Our goal, of course, is to provide the rental assistance to eligible low-income families. And HUD's standard has always been and focus is to provide safe, decent, and affordable housing in our region. Since 1998, our program has grown. Unfortunately, it has not grown to the point where it has met the need. So this leads me to our waiting list. Our waiting list has been closed since July 1st of 2023. However, our project-based waiting lists are open and we're currently accepting registrations. Based on funding availability, we will make selections from the closed waiting list. as long as our funding allows us to. Our priority right now is to provide, to select the veterans and widows of veterans first. After we selected all the veterans and widows of veterans, we will then move to the next category, which is our seniors that are 70 years and older. After all the seniors that are 70 years and older have been selected, our second level preference are the elderly between the ages of 62 and 69, our disabled individuals, and families with minor children. And that's probably the longest one. I know, Karen, you had asked me if we could see our project-based developments. So on the other side of the house, through our housing and community development, this is the link to the website where you can see not only the project-based voucher sites, but also what our community and housing development has been able to fund to help developers build more affordable housing. So I do encourage you to visit that site and look at what's available. The PBV sites, we will maintain the waiting list. On the other sites that are not PBV, you'll want to contact the properties directly and find out what their availability and if they maintain their own waiting list as well. But we're very proud of our PBV program and expansion. And our family self-sufficiency program. We know that receiving rental assistance is not someone's goal for the rest of their life. We do have many participants who are working able, who can voluntarily join the Family Self-Sufficiency Program. We can only serve those who are currently receiving the Section 8 assistance, and they will work one-on-one with an FSS coordinator. We currently receive funding to have 7 full-time FSS coordinators that will work with our families. And we do partner with our local workforce development center because we get job leads, we'll send them out, financial counseling. The biggest incentive, of course, is the escrow savings account. Whenever a Section 8 participant joins the FSS program, they're going to be at a certain income, and that income may or may not be earned. Once they're on the FSS program, and if they experience an increase in their earned income that allows them to pay a higher portion of their rent, the amount that the housing authority is no longer subsidizing for them is placed into an interest-bearing savings account. Each month that they pay this higher rent, we put that amount into their savings account. And if they completely finish their goals that they set for themselves, we will release the escrow savings accounts to them. So again, I always treated this before I had my own family. FSS was my first child. So as my firstborn, I love it dearly. On the next slide, you'll go ahead and see some of our success stories. Both were graduates recently in the calendar year 2024. The first one is the Thomas family. They increased their earned income from $11,189 a year to $47,039. They accrued a savings account of over $27,000. And the family's plan was to pursue home ownership as well as education. So that's a nice little nest egg to take with them to do so. Next is the Gutierrez family. They were able to save over $36,000 in their savings account. And they were successful in moving off of cash aid. And their goal was to achieve economic self-sufficiency, which they did. So we're proud of both our families as well as the others that graduate. The challenges ahead, I think, as you all know, the rising cost of housing and the short supply of available affordable housing. Our waiting list is very long. The one that we had to close currently has over 140,000 registrants. And we only can support about 9,100 families, so that can lead to long waiting lists. And we're waiting on funding availability for new vouchers. We haven't received new additional funding, so we're waiting to see what will be appropriated for next calendar year. And opportunities. With the help of the other division, the Community Housing Development, who works solely with developers, we've been able to expand our project-based voucher developments. That has added a pipeline of units that hadn't been there before. We are always looking to strengthening our partnerships with community services as well as partners like yourself. We are very excited in that we are able to transition to a new housing case management program that is completely online. So we're trying to go away from the paper and try to make the ease of application as well as processing, people submitting things to us easier, because as we can see, we can almost do anything online now. And of course, we will continue to promote and expand our FSS program so that each participant is given the opportunity to participate and succeed. So I have my contact information, and I just want to thank you and everyone on this call, for allowing us to work with you to serve our community.
Thank you, Cindy. Does anybody have any questions? Well, Cindy, just on behalf of the whole entire continuum of care, we're truly grateful for the amazing work of what you and your team do. It's incredible, and you're never too busy to help. I say that as the chair, representing 2 different cities. You just have such a great servant's heart, and we just appreciate you so much. Thank you.
Thank you so much. It's a pleasure to work with you guys as well.
Okay, if there's no questions, we'll move on to the next agenda item. We're going to move to agenda item 5, which is consent item. Julie, do we have a quorum?
Yes, we do.
Okay. At this time, I would like to entertain a motion to approve the May 21st, 2025 Continuum of Care meeting minutes. Do I have a motion?
I'll put
I
forth
move we approve the minutes. It's Lisa Quinn from Valley Restart.
Okay, I'm sorry, something happened. You guys muted out. Julie, did we get a first and a second?
I heard
I'll
Lisa
second
Quinn
that.
with Valley Restart.
Okay, and then who was the second?
Kim Askew, Labor of Love.
Okay, perfect. Do I have any abstentions or objections? Hearing none, the item passes. Let's move on to the next agenda item. Agenda item 6, new business. Oh, I'm so excited. Maribel Nunez, Executive Director of Inland Equity Community Land Trust presentation. Maribel, my dear, we're so excited to have you. The floor is yours.
Thank you so much. Hello, everyone. I'm here with myself, Maribel Nunez, and then here with Jeff. Do you want to introduce yourself?
I'm Jeff Crane. I'm the Associate Director of Inland Equity Community Land Trust.
And so I'll just say a few words and then I'll pass the mic to Jeff. So yeah, we're Inland Equity Community Land Trust. We were founded in 2019. We were formerly Inland Equity Partnership, and we come from a history of doing a lot of anti-poverty, community engagement and policy for health and human services and housing. And so part of the other projects that we're working on is the Inland Empire Tenant Union. So here today, we're going to share a little bit about our pathways to home ownership through a community land trust. And then also we'll share, one thing I did want to share that our other project is Inland Empire Tenants Union, which includes tenants' rights, creating policies. Some of you all, we work together, Karen and a few folks here. And also see Sarah Cortez on the just cause and rent protections for mobile home parks and residents that live in apartments and houses. And so we work on a lot of different issues and rights connecting to programs like HOPE programs, legal services. We work with Inland County Legal Services and a lot of other folks. And then we're also fair housing certified as well. So we're glad to be here. And we want to share a bit more about our community land trust and also share a little bit about the HOPE program. We have some feedback. I'll pass it to Jeff.
I just, whenever I talk about the community land trust, I like to talk a little bit about the history. So on the slide there is Slater King, Bob Swan, Faye Bennett, and Albert McKnight, and Charles Pregen, who are the board that first formed the New Communities Community Land Trust in Albany, Georgia. This was during the early 1960s. Faye Bennett and Albert McKnight had a program where they would buy sharecropper debt and then move the sharecroppers onto new land that they could farm and pull them out of a cycle of poverty in the South. And new communities was community land trust developed so that sharecropper farms and other poor farmers could get together. And then you can go on to the next slide. The next slide is our board. And we have a couple of new board members that are not in that picture, but for the most part, that's our board. And Maribel and myself are in there. And we are the Inland Equity Community Land Trust, and we are building 4 homes in Adelanto right now. We just pulled our permits finally after we thought we would be done about a year ago. And if you go on to the next slide, you'll see a little bit about it's about 1,000 feet from the high school. That just gives you a sort of sense of where it's at near Adelanto. And then go on to the next slide. That is a picture of the actual property in Adelanto. And we have a well dug right now out there. They're doing the grading and grubbing. So once they get done with that, we'll have the foundations being laid, and the homes, if you go on to the next slide, those homes they're delivered, they're manufactured houses. They'll be on an MH Advantage foundation. So they're attached to the foundation on the ground. They're not like on an axle. So they do qualify for, regular Fannie Mae, Freddie Mac loans. And our goal is to make them available at about $300,000. And so if you ran the payments on that today, it'll be a 3-bedroom, 2-bed bath house that you'd be able to buy into the community land trust. And it would cost you less than market rate rent for a 3-bedroom, 2-bath house. And so that's what we're really proud of. If you're not familiar with the community land trust structure, the homeowner is going to buy the structure. The nonprofit Inland Equity Community Land Trust holds on to the land, and that ensures the permanent affordability. The difference between what we're doing, the equity part of it, is the difference between the sell price and the market price, or the appraised price, is going to be called an equity share. And when they sell the home, that equity share is going to go back to the next buyer. So that keeps it permanently below market rate. And that's our goal as a nonprofit, is to build housing that we can make available at below market rate, and also remove a lot of the speculation out of the housing market. So the house becomes an instrument to live in and not a financial instrument. So these are in San Bernardino County. So they're available to people that are from the county of Riverside. We are eyeballing an opportunity in Lake Elsinore and another one in Jurupa Valley, where we hope to repeat the cycle. So these would be slightly larger projects, but they would be in Riverside County. And I think that's what we do, other than, again, the tenants union that Maribel mentioned earlier. I don't know how much more time we have, or.
Yeah, if you want to share that, sure.
Okay, so I think one of the things we did, there's an apartment complex with the tenant union there that's over on Las Palmas Avenue. And that apartment complex has serious habitability issues. And the H-Hope program was placing people in that apartment complex. And so we brought them to an oversight committee meeting of the Continuum of Care. And those people spoke out, and some of them, I'm not exactly clear exactly how it's been resolved, other than a lot of people now are aware of the circumstances that Wonder Dog Management have created. And hopefully, the county agencies that are responsible for dealing with Wonder Dog Management deals with them judiciously. I don't know. I don't know how to be politic. I want to say don't do business with Wonder Dog Management anymore.
So yeah, okay. So yeah, we're here to share sorry, my camera, for some reason, I'm having issues, but we wanted to just share about the different types of programs that we work on the affordable housing side, but also on the community engagement and tenants' rights with our IE tenant union. So yeah, we're here, and I'm not sure, Karen and Zuli, how much time we have, but we're here if there's a few minutes for questions, or if not, we really appreciate the opportunity to come and present.
Oh, well, we'd
Well,
love to
I
see if
spoke a little bit
members of
about
the
that.
Continuum of Care have any questions. Please raise your hands. A lot of great information that was presented. Anybody have questions? Well, I think it is extremely innovative, and we're excited to hear about this and just hear how this continues to grow and evolve. Maribel, I just want to thank you. You play a number of different roles. And I just want to thank you for your advocacy efforts that I've seen you play at multiple levels, especially with respect to very complex housing programs. And I know you have a lot of expertise in different areas. And for sometimes for members of the community with these very, very complex programs, you have such a gift to be able to take these things that are so complex to help people understand what opportunities they have, what their rights are. It takes a special gift. So I hope you and your colleague know how much we appreciate and love you guys.
Thank you. Thank you so much for the opportunity. And we love you all back as well. And I know I'll see you later today.
Yes, I'll see you tonight, Maribel. Okay, let's go ahead and move on to the next agenda item. 6.2 updates on governance charter. Zuli, I'm excited to see you presenting. This is so cool. You all see Zuli behind the scenes, and she's always so humble and quiet, just doing what she can to manage the meetings, but she has other duties. And so she's going to showcase some of her duties today. And I know Miss Tanya is proud of her staff. So, Zuli, let's get an update on the governance charter changes.
Of course. Thank you so much, Karen. I appreciate your kind words. I'm gonna go ahead and stop sharing my screen so I can share the governance charter. And as you all may or may not know, every year we do have to update our governance charter. So we do want to bring these updates to y'all in advance. It won't get adopted until next month, so it is available in the Google Drive for your review. If you have any questions or suggestions, you can send us an email at coc@rivco.org. But I'm just going to go through these updates really quickly, and at the end, if you have any questions, feel free to share them. But here on this page, we do have some charter date updates. These are revised to reflect the most recent approval and revision dates. And this is our table of contents. It also got updated to reflect all the new and modified sections, as well as just editing the numbers on there, the page numbers. And then the next update would be on section 5.3 under becoming a member. We added hyperlinks to the COC membership application and the appointment letter for easier access so that if someone's reading the charter, they could just click on it and go directly to the application. We also added a section that says becoming a voting member. This was already in here. We just added the header here. So it outlines the process and requirements to becoming a voting member. As you scroll down, we also added the letter of support policy. This was adopted on April 23rd, 2025, and we just added it to the charter so it could be all in one place. Below, we just edited some of the numbers there. On this section, we added the COC meetings section, it states that members can attend meetings and provide feedback. And if we scroll down, similar language was added under the BOG meetings, says the same thing. And then we also added the delegated authority policy. This is another policy that was already adopted on October 19th, 2023. So we just added it here so it could all be in one place, but it outlines HWS's authority to reallocate and reprogram funds. We also added the drafted good neighbor policy. This, we presented it, I believe, last month as a drafted form. Right here, it's just a brief description, but at the end of the charter, it has the attachment with the actual details. And we also removed the section 8 here, or 7. It says it's for the HMIS and CES Oversight Administrators Council. We removed that as the group is no longer active or needed. And then that's all the major updates. If you scroll down, again, just minor number changes. And then date changes here. We also changed the name to reflect the right name of the department here. And in the end, there's the attachments. So an attachment A for the letter of support request form, attachment B, the letter of support template, attachment C, which is the delegated authority policy, and attachment D, which is the drafted good neighbor community policy. You could see it here. And that is all of the updates for the charter. Again, this will be adopted or be brought to adoption at next month's meeting on July 23rd.
Thank you, Zuli. I'm going to jump in here to just add a couple things. So one being that, as Zuli mentioned, we wanted to give each of you time to review the COC policies that have been incorporated, that have been updated. I wanted to add that when we met last month and we discussed the Good Neighbor policy, we agreed that we would bring it back to the continuum of care as a motion for approval at this meeting. Since we were already updating the governance charter, we felt it was appropriate to include that here and then bring a motion. So actually give additional time to the COC and then just ask for a full blanket approval of the governance charter, which we just reviewed with you on screen. So I want to emphasize that this essentially provides additional time for feedback on that item and certainly for all of the different items that Zuli spoke to. In response, I wanted to highlight and just kind of remind us why the Good Neighbor policy is such a big deal in today's world where homelessness is if not for the city of Corona, who really led the charge with this and actually through multiple conversations with Karen Roper, who you know as your COC chair, but also represents the city of Corona. We made sure, or she, really worked closely with our team to make sure that we incorporated good neighbor policy language in our homeless action plan, and even took a step further once the city adopted its policy, shared that policy with us so that the very documented language that you're seeing in the governance charter was something that we didn't have to, we didn't have to start from scratch, which oftentimes all of us know that those things take time. So we were 10 steps ahead because of the good work being done there. So I just wanted to acknowledge Karen, and of course, and if Mayor Steiner is still here, the entire city of Corona for helping us with that effort.
Thank you,
And
Ms.
that's
Tanya.
it.
No, Ms. Zuli, are you complete with this particular item? Thank you, my dear Tanya. Does anybody have any other questions or comments? I hope you guys will take the time to read this together, but Tanya mentioned something that's so important. You know, there's no reason to reinvent the wheel. So when we can select all, so that we can just be about the business of helping the people that are in front of us. So thank you guys so much. Let's go ahead and move on to the next agenda item, 6.2, updates on, oh, excuse me, 6.3. Thank you. Encampment protocols. And it looks like we have, is it Tanya and Emma both doing this today?
Yes, I will go ahead and get us started. So good afternoon, Madam Chair and Continuum of Care members. Emma Perez Singh, Division Manager with the Office of Homeless Services. So it is my pleasure to discuss this new business item regarding encampment policies and procedures. So Governor Newsom recently released a model ordinance aimed at helping cities and counties address homeless encampments with urgency and dignity. And the ordinance encourages local governments to swiftly clear encampments while ensuring that individuals experiencing homelessness have access to shelter and services. And prior to COVID, the county had drafted an encampment policy and procedure to support encampment response in the unincorporated areas of the county, as well as on county-owned property. However, this policy has not been formally adopted, and we now intend to formally adopt this policy. I'm going to quickly go over just some key differences between our policy, our proposed policy, and the model ordinance. You will find that our policy is in line or exceeds the minimum requirements of the model ordinance, but we just wanted to quickly go over it, and we will be sending out the ordinance prior to adoption to provide the COC an opportunity to inform the policy through review and feedback. So please be sure to keep an eye out for that. We anticipate sending it out within the next couple of weeks. So without further ado, we can go ahead and get into the presentation. So one of the areas where our policy is a little bit different from the model ordinance is really in the legal framework. It really isn't a whole lot different. There are a few things like the notification. The model ordinance asks cities and counties to provide a minimum of 48 hours notice before clearing out an encampment and make reasonable efforts to connect individuals with shelter and services. And the county's policy currently exceeds that at 72 hours. So that is one of the differences. Additionally, the model ordinance, the model ordinance prioritizes constitutional compliance and includes considerations for ADA. We also have those considerations, but we expand beyond the minimally required examples that are provided in the governor's ordinance. You can go ahead and go to the next slide, Zuli. The operational structure has also been is a key difference where the model ordinance encourages a streamlined local response. Our policy is much more detailed and includes a structured incident command, which is led by an encampment coordinator. And it also emphasizes a multidisciplinary team with specific roles for encampment response. And when you read the policy, you'll be able to see that detailed But it's a key difference from what the governor has proposed, which is really just very basic. Our policy goes much more in depth, and it has been informed by stakeholder meetings and series of conversations and feedback that was collected prior to the drafting. Next slide, please. One of the more notable differences, as I had already mentioned, are the notification and property handling. So there are minimum suggested limits on the governor's policy, namely, again, the prior notification and the handling of personal belongings, whereas the model ordinance suggests 48 and 60 days. We exceed that by providing 72 hours and 90 days. All right, next slide, please. We also have a structure where we have a trigger-based response model, and you'll see that detailed in our policy, and also have a prioritization schedule based on the incident and what's occurring around the encampment. So if there are health and safety risks, then there are contingencies that we can employ that allow us for a quicker response. Next slide. So our policy, of course, includes the use of HMIS, SharePoint, our mapping system, and assessment apps. And also, you know, we are looking at providing ongoing reporting quarterly and annually, and really look at our data to drive our decision making, which is really in line. It's not such a difference, but it's really in line and tailored to what we have available and what we currently use here in our community. Next slide, please. I think we should be close to the end. And again, you know, we have detailed coordination with over 20 county departments. We also have coordination with other partners and prioritizing housing linkages and support from all of the different multidisciplinary partners that we work with. I've listed a few on the slide. There are many more that we work with on a regular basis to help connect the clients as we're engaging them in encampments. Next slide, please. And so really both policies aim to balance that community safety and the needs of the individuals. We really have a detailed framework that we feel will meet the needs of our communities here in Riverside County. And again, this policy will be implemented in the unincorporated areas of Riverside County and county-owned property. Individual jurisdictions, the state has encouraged all jurisdictions across California to look at adopting some ordinance, policy, something to help inform how encampments are addressed in that in their respective jurisdictions. So while the governor's model sets a general state alignment standard for jurisdictions to adopt, ours has gone above and beyond that and really looking to support both the encampment mitigation aspects as well as maintaining a person-centered approach. So again, that policy will be going out to the COC and we'll be soliciting feedback. We will provide details in terms of how that feedback should be provided to us and by what dates. That'll all be included on the communication that goes out. And I will go ahead and pause for questions or allow Tanya to jump in if she would like to. And I see one question from Ayoko.
Hello, Emma. Ayaka
Hi.
here. Thank you for this presentation and thank you to the county for taking these steps to handle our encampments. I was maybe more than a year or so ago, I believe it was Tanya who mentioned that you were reevaluating your prioritization tool. So you were moving away from the ICE into something else. I believe it was homegrown, and I was wondering if you could talk about that a little bit.
Sure. Tanya, do you want to jump in or?
Well, I was going to say if Monique or anybody else from the RUHS behavioral health team is on, who serves as our CES or Coordinated Entry System lead agency, we'd love to hear from you. If not, we can absolutely jump in and provide a brief description. So with that, what I thank you, Ayako, for bringing that up. Our county behavioral health team has been working closely with a vendor to develop a new tool and has made really great progress. Essentially, what this new tool does is it looks at data from our homeless management information system alongside other systems of care, such as our hospital, behavioral health systems, to look for mutual contacts, so that people that are experiencing homelessness and the workers who serve them have a better sense of actual needs. And I'm going to emphasize the actual needs because currently, as you are all aware, we look to an assessment tool known as the VI-SPDA to gauge a person's vulnerability. And it's essentially a survey that's conducted, or we ask people how many times, how long they have been homeless, how many times that they have interacted with all these different systems. It's essentially all self-report. And what really drove us into looking an alternative method for prioritization is essentially research studies that showed that people of color primarily did not always report accurate information because of fears and their own perceptions of what or how that could impact them as a person. So as a result, we're moving towards a new system that will look at mutual connections across various systems of care to determine prioritization. And our plan is to bring back our county behavioral health team at a future meeting to be able to touch on that subject and share with you guys more on when we will be ready to launch.
Yeah, that's amazing that you have such foresight to try to develop something that really suits this community with the providers. So that's amazing. Looking forward to it. Thank you. It will serve the community better.
We have another question from Lindsay.
Hi, good afternoon. This is great, and it's great to see that Myriad is already aligned with what you're putting out there. My question is, since the cleanup is such a important thing at this point, especially for the state, do we anticipate any funding to cover cleanup costs coming through? We're fortunate we do have a budget within our city, but it's an extremely expensive task, especially with the hazardous material. So just thought I would ask.
We know that there has been advocacy to reinsert language in the program rules for the state's encampment resolution funding, or what we refer to as ERF, and support our current efforts in the Santa Ana Riverbed, the San Jacinto Riverbed, and then now the Merida Creek Trail. So there's 3 grant awards that we received and primarily paid for staffing. As some of you know, during the first round of that funding, cleanup was an eligible cost, but that was removed during the second and now third round. We know that there will be another ERF grant opportunity being released in the summer, and then later this year or in early January is sort of the timeline. So 2 future rounds, And I think we're eager to learn whether cleaning resources will be included. But Lindsay, that has been a large request by cities and other communities that receive this funding. So we'll have to wait and see.
Thank you.
So it looks like our chair, Karen Roper, is having some technical issues with her mic and camera. So Zuli,
hear
if you
me?
can. Oh, now we can. Yes.
You know what I had to do? I can see you guys on my screen. I just went ahead and called in on my phone too. So multiple paths to address technical glitches, right? Thank you though. Okay. Sorry if I missed something. I was trying to get logged back on. Are we finished
We're
with
ready to
discussing?
go. Yeah, we're ready to go to the next item.
Okay. All right. Thank you so much, Miss Emma. Good job as usual. It's nice to see you, by the way. Okay. Agenda item 7, standing items.
Oh, and that is me again.
Okay.
Thank you. And thank you for the greeting. I appreciate that. So just one item for you today, very quickly. We wanted to make sure to provide advance notice to all of the continuum of care regarding some proposed changes to our HMIS charter. We are asking for feedback regarding these changes, which include newly revised data timeliness changes. These changes will change the current requirement from 7 days to 3 days. And the primary reason why we are doing this, or we are proposing this changes, will be to support having access to live data to help support emergency response and in line with the live data to be able to develop real-time databases. So unfortunately, because of the way that our data timeliness standards are currently written, we do have a lag in being able to see where we currently stand. And so moving this to the 3 days would really help to just really get a grasp on where we are at any given point. This information has been shared with most of our agencies that we contract with through technical assistance calls, but this is providing you an additional venue to give us formal feedback. We are also proposing to revise the data required fields to include services rendered, case notes, and client document. And this will allow for continuity of services. We have had cases with clients being transferred from one agency to another and seeing an inability to maintain continuity of care because these fields have not been completed in HMIS. So we really see this as a benefit to ensure that information isn't lost if a transfer occurs, and we would continue to be able to provide those critical services to our clients. Additionally, we are proposing to allow agencies an option to purchase additional licenses beyond what is currently allotted. There will be a sort of purchase form that is included for agencies to utilize with the cost associated per license. And currently our HMIS charter provides 1 license per 25 clients. So this would be to purchase additional licenses. So as with the other proposed changes to the governance charter, the adoption of the encampment policy, the HMIS changes will also be sent out for feedback with dates on when that feedback is going to be due. We encourage all of you to review these changes. They are being included as an addendum, so I do want to note that. And the primary reason for that, rather than incorporating them into a restated full version of the charter, is because We are already anticipating for HUD to make some changes later in the year. And so we wanted to do them all at once, if you will. And so the addendum will be a separate document to the charter, but will still be incorporated. And then once we get the changes from HUD, everything will be incorporated together into the one charter. So I did want to explain that because that is a little bit different from our normal process. And those are the COC updates. I will pause for any comments or questions. All right.
Hey, thank you, Miss Emma. Let's go ahead and move to the next agenda item. Okay, 7.2, coordinated entry system lead update. Miss Lucy, are you here? You have the floor.
Hi, can everyone hear me okay?
Yeah.
Okay, perfect. Hi, so I'm going to go ahead and give the overview for the month of May for CES. Next slide, please. So regarding the Home Connect calls, there were roughly 358 phone calls for the month of May. 174 of these were resulting in diversion by providing resources to prevent homelessness or eviction. 81 callers were screened and linked to the coordinated entry system. Of those that were screened, 19 were families, 1 identified as a veteran, 11 were ages 55 plus, and 7 were of TAY aged. Next slide. And when looking at the community queue, there were roughly 904 members pending housing opportunities, with 169 of them being added during the month of May. The cities with the highest number of residents on the queue included Riverside, which saw a decrease of 6% from April to May, India, which also saw a decrease of 3% from April to May, and lastly, Palm Springs, which saw a bigger decline of 16% of members in the queue. So CES does project these numbers in the cities to reduce due to the number of district-specific opportunities that are coming up. And in the month of May, CES had 83 open and active Home Connect referrals to housing opportunities across different COC-funded projects, 33 of which were connected to permanent supportive housing opportunities, and the remaining 50 were to rapid rehousing opportunities. Next slide. CES is reaching out to agencies that have members on clarity and advising of the steps to take to ensure that those on the queue are up to date with documentation and program activity to be connected to housing opportunities. We're also providing trainings regularly regarding clarity usage and best practices during the CES partnership meetings, and as requested to ensure data quality remains a priority within the coordinated entry system. CES has had the opportunity to dwindle the numbers down on the community queue. At the beginning of this year, at the end of January, the community queue was at 1,020 members. And as of this last report, as mentioned earlier, we are now at 904. So this is an approximate 12% difference as a result of training, follow-up, and appropriate exiting. And if you're attending my CES biweekly partnership meetings, you've seen the best practice trainings I hold every meeting to ensure that data quality and up-to-date practices for the coordinated entry system and clarity are being utilized. And I will be working on instilling a feedback questionnaire to gather information and understand the needs of CES as a whole. If you're not familiar with my biweekly virtual partnership meetings and are interested in attending or know of an agency that would benefit from participating, please email us at HomeConnect as shown on the screen so we can get you into that next meeting on July 1st. Next slide, please. So we are looking to fill up the last half of the year with presenters for the said partnership meeting. And again, it's held virtually every other Tuesday. We have case conferencing and resource meetings, so those are 2 different tracks that you can look into. So if you're part of an agency that is population focused, such as individuals that are justice involved, veteran specific servicing TAY-aged members, if they provide mainstream services like substance use, healthcare providers, social welfare agencies, or agencies that provide housing, such as Mercy House, Lighthouse, and you're interested in presenting and want to get some exposure Riverside County wide, please again reach out to myself personally or our Home Connect email. Next slide. So CES is looking for feedback. So if you have a quick moment to scan the QR code to provide feedback for myself, I can also put the link to the form in case it gets lost down the road. Okay, so any recommendations, any feedback, I'm open to it. CES as a whole is open to it. So please feel free to share. Next slide. And if you have any questions or requests, please reach out to the CES admin team as pictured on your screens. Eventually, one of these days, I swear we're going to get pictures on there. But as of now, you'll see our faces on the screen during the meeting. But other than that, that's all I have for you all today. Do we have any questions?
I just wanted to, if you could just say hello to Monique and tell her we appreciate her, John, you, the whole team. I don't think she's on. If she's on, I'm sorry, but I just wanted to say hello and tell her
Yeah,
we are.
of course. I know John's on.
Yes, I see his smiling face. Hi, John.
Yeah.
Hi, Karen. Hello, everybody.
Thank you, Karen, for your kind words.
Of course, of course. You guys play such an important role in this big system. There's one big, huge safety net, right? Like a big blanket. We all are a part of it. It's gotta work so we can catch people when they fall off the tight wire of life, right? So,
yes.
Okay. Excuse me. Let's go ahead and go to the next agenda item. Okay, 7.3 housing policy update. We're going to go ahead and skip this item. Greg is not able to present today, but I know he will get back with us when he's able to. So for now, agenda item 8, informational items. You can see for both the committees, no meeting. And of course, we had the exciting opportunity to once again sign a letter of support for WEA. So we're always happy to do that. No APRs for your review this month. Let's go ahead and go to the next slide. Okay, at this time, we'd be happy to entertain any suggestions or call for agenda items for the next meeting. Does anybody have anything they'd love for us to put on agenda? This meeting is for you. We're all one big family, so I hope that you will not be shy. If you feel like there's something that you want to learn, something important, some important policy issue we need to discuss, program design, whatever it may be, we'd love to get your suggestions. Remember, this is for you, so we want to do what we can to be as helpful as possible. Yay, Ayako, let's hear it.
Okay, well, Ayako Utsumi here, and you have discussed this in the past, and that is home sharing or shared housing. I know there's a group in San Bernardino that they're undergoing kind of a collective training, and
Yako, you went on mute. There you go.
okay. Yeah. Okay, I'm sorry, where did I leave off? Okay, shared housing or home sharing. There's a group in San Bernardino that's jointly taking some classes together, some technical assistance together. I know there's a group in San Jacinto that wants to take a closer look at shared housing. So there's kind of two buckets. One is for perhaps more your, grandma has an extra room versus shared housing that might be more focused on people formerly experiencing homelessness with behavioral substance abuse issues. So there's different types of shared housing, maybe not for next time, but over sometime this year, perhaps we could get together and talk more about how shared housing can be one piece of the solution to prevent and end homelessness.
Yeah, Ayako, do you think that that group you're referencing is at the point where they have enough capacity and bandwidth to present? Are you suggesting that, or just kind of saying movement's happening over there, we want to see movement here? So what are your thoughts?
Okay, that's a great question. perhaps we could discuss that offline with them and see where
Okay.
they are. Yeah.
Yeah. And also, if you are able, I don't know if you would be willing to conduct any research to see if there's any other shared housing programs that you have heard of. Tanya, I don't know with the work that you guys do with Joe Coletti and the other continuums, to maybe we can, maybe Joe could tell us if we know of any best practice models that are functioning in some of the other continuums. Emma or Tanya, could we ask Joe if he is aware?
Yes. So through urban initiatives, Joe Coletti has created like a Southern California collective, so we can pose a question there and see what responses we are receiving. I'll let Emma, if she's available. I know we're all multitasking, so she might not be. And if she isn't, we'll bring it back. But I do know that we have a collective group of individuals from our region that have been part of a shared housing collective. Oh, here's Emma back on.
Yeah,
Speak to that.
Ayoko mentioned the San Jacinto group. So we, along with Jennifer O'Farrell with the Healthy Valley Foundation, Javier with Valley Restart, Melanie Steele, myself, and some others have been participating in classes through a shared housing certificate program that Jennifer actually sponsored for us. And so we are probably about a little bit more than a quarter of the way through those courses. And so we hope to have to make that available to others. The cost is really not prohibitive. I think it was like, Ayoko, do you remember for like 6 people, it was like a few $100s. It really wasn't a
I
whole
thought
lot.
it was a couple thousand, but still, it's very
No,
reasonable for technical assistance.
yeah,
Yeah.
no, I don't think it was a few thousand. I think it was less than that. But this is, I believe this is the first cohort, and they're anticipating offering additional cohorts.
So is it just to train to figure out how to build capacity to do it?
Yes, so it covers a myriad of different topics. So we've heard from other providers and looked at their models, best practices, things like that.
Emma, do you feel like you guys need more time or would be ready to do something in the future to kind of bring what you've learned and maybe what opportunities we might have to build some capacity in the county?
Yeah, I think once we finish the program, we probably would have a better grasp on, because right now it's things that we may already be doing and exploring. We were looking at models. Some of the things are similar to what we're already doing here in our county. And so, I think we just need a little bit more time.
Yeah, well, it happens informally across our region with our
Yes.
nonprofits that are partnering with landlords, that, they have space in their home. But I think, to truly build capacity, have an organization or multiple organizations that can build relationships. It's kind of like dating and matchmaking, right? Because you're
Yes.
trying to match
Yes, it is.
people to,
Yes.
to share their house.
Mhm.
And sometimes there's discussion about pets or,
Of course. Room
smoking or,
temperature.
yeah. So it's like dating and matchmaking, but boy, it's certainly an affordable option and
Yes.
it can be a win-win. So I
Yes.
would love to see some capacity built in that area. So I
Great.
thank you. Let's definitely do it.
Great.
Emma, can we maybe rely on you and Ayoko to let us know when you think you guys are ready?
Sure.
Okay.
Yeah.
That sounds good. Anybody else have any other suggestions for agenda items? Okay. I think the next item should be, you go to the next slide, Miss Zuli. I think it is probably, announcements. Yes. Does anybody have any exciting announcements? You have to look at that beautiful picture and be inspired. It's going to make you want to give an announcement. Come on, you guys. What cool things do we have going on out across the region? Anybody?
Hi, I have one.
Let's hear it.
Hi, this is Kanisa Jones from Silence Aloud in the Bridge Wellness Center. Wanted to invite everyone out to our open house and resource fair, trying to get the community aware of the new YHDP drop-in center. And so it's really to provide an overview, kind of like a sneak peek to the community of some of the services we'll be offering. So we'll have a variety of workshops for the youth or anyone to attend, particularly the youth, financial literacy, mindset workshop, how to pitch yourself. The YAB will be doing a lived experience panel. We'll be giving away some new bikes donated by Kaiser. We have a game truck, free food, just different things for the community. And we are looking for some additional volunteers if anyone's available. And I can put a link to a volunteer sign up form if you're interested in the chat. And let's see what else exciting do we have going on. It's 3 o'clock this Saturday, the 21st to 9:30 p.m. So the open house component is 3 p.m. to 7 p.m. And then the talent show begins 7:30 to 9:30. And our experience with the youth, since we give away $1,000 worth of cash prizes, it's a real big we usually get a big turnout for those type of events. So we're really just trying to make the youth aware that the program is here for the drop-in center services so that we can begin to serve more youth. So I hope you guys can all make it. And
thank you. And if you want to reach a broader audience than just those that are here, you're welcome to send the flyer to the coc@rivco.org, and they can send it out through the Continuum of Care if that's helpful to you. So
yeah, I think you guys sent it out once already, but it wouldn't hurt to send it out again. That would be appreciated. So
okay.
Okay, thanks everyone.
Thank you. Appreciate it. Okay, let's see. Who is next? Jeff.
Hello, can you hear me?
Yes, we can hear you.
Okay, I'm just gonna, we have our biannual membership meeting at the Harupa Valley VFW post this Saturday at 2 o'clock. If you're interested in meeting some of the people involved in this community land trust, or you would like to get involved, that would be a great place to come meet us in person. And then July 26th, we're going to do a press conference / rally outside of the PAMA. PAMA was just indicted by the California Attorney General's office, and we've been organizing tenant unions in San Bernardino where they manage several slums. And so we're going to do a rally outside of their office, which is also Bridge Management and Hightower Management, because they're all the same company. And so that'll be July 26th at 9 a.m. If you want information on that, you can go to the IE Tenant Union website.
Perfect. Thank you. Anybody else? Okay, next slide. Okay, meeting adjournment. And then the next slide after that, of course, is the future meeting. So you always have that available to you. It is 4:43, you guys. So we can adjourn early, and there's still 83 people here. So I just want to thank you all for all the great work that you do. You got 15 minutes extra to help a bunch more people. And we look forward to seeing you at our next Continuum of Care meeting. Have a beautiful rest of your day. Thank you.
Thank you.